When measuring someone's blood pressure, you want them to rest at least 5 minutes. Make sure they haven't had any caffeine or nicotine 30 minutes prior to assessment. Make sure their back are supported and feet uncrossed. Elevate the arm at a heart level and find the pulse under the brachial artery. If necessary, please roll their sleeve and make sure it doesn't get too tight. In order to hear the proper heart sounds, we will use a stethoscope. Make sure the earphones are facing forward. It is very important to properly choose the correct cuff size in order to have accurate readings. When choosing the cuff size, if the line is below, the cuff size is too small. If it's on the middle, the cuff size is fine, and if it's above, it is too big. Blood pressure is measured using an instrument called sphygmomanometer in the units in millimeters of mercury. The next step you want to do is to make sure to align the artery mark located in the cuff to the patient's brachial artery mark. After placing the cuff correctly, place the chest piece of the stethoscope on the brachial artery so you can hear the heart sounds. Then make sure that the knob of the pump is turned all the way to the right. Then start pumping so that cuff can start inflating. Pump up to 200 millimeters mercury. Then release pressure at a rate of 2 to 5 millimeters mercury. While releasing the pressure, you will need to pay close attention to the heart sounds. There are 5 sounds, also known as the Korotkov sounds. The first one is the patient's systolic blood pressure. The second sound is the swishing noise. The third one is a louder tapping. The fourth is a blowing sound. And the fifth one is silence, which is also known as the patient diastolic blood pressure. Then you will release pressure and let the patient know about their systolic and diastolic blood pressure. While taking blood pressure, you will start pumping up to 200 millimeters mercury per second. Then after reaching that number, you will start releasing pressure at a rate of 2 to 5 millimeters mercury per second. The first thumping sound is called systolic pressure. When you no longer hear the thumping sound, that's the diastolic pressure. Normal blood pressure is less than 24 systolic and less than 84 diastolic. Presentation is 120 to 139 for systolic and 80 to 89 for diastolic. Stage 1 is 140 to 151 for systolic and 90 to 99 for diastolic. Stage 2 is 160 or higher for systolic and 100 or higher for diastolic. Higher of 180 and 110 needs medical attention.